I was just looking in my pocket, and I have a pretty much almost empty bottle of hand sanitizer.
Oh,
And-
just go out and buy another.
Yeah, but that's the problem, because good luck finding one, and we'll tell you about that when KNX In Depth continues.
You're listening to KNX In Depth. I'm Mike Simpson, along with Charles Feldman.
Well, people are, we mentioned this before, they are flocking to drugstores, Costco, and other places.
The lines.
Yeah, because they're trying to stock up on hand sanitizers, antiseptic wipes, and stuff like that in order to avoid this coronavirus. Purell says it has seen a big increase, yeah, no kidding, in demand and has increased production significantly. It says it is prepared and not worried about running out. But does it make that much of a difference? Should we be all running around trying to buy up this stuff? With us now is Dr. Richard Seidman, who's Chief Medical Officer for LA Care Health Plan. So, Doctor, I keep hearing messages day after day, hour after hour from the CDC and others saying, wash your hands, and if you can't do that, use hand sanitizer, but you can't get the hand sanitizer now. So what do you do?
Well, I think we should take the advice we're hearing from the CDC and wash our hands. I understand that people are reacting and thinking they should do something in addition to the basic precautions we should all be taking. But simply in the absence of being able to find Purell or other antiseptic wipes, washing your hands is the best advice and one of several everyday precautions we should be taking.
And just train yourself not to touch your face as much, which is hard. I don't think we realize how much we touch our faces, but you can try and stop.
I think that's true, but I like the sense that we should seek to reduce the frequency with which we touch our faces. It's not easy to change a lifelong habit, and apparently we all touch our faces much more than we think we do, but if we can consciously try to reduce that habit, that would also help reduce the spread of all diseases, not just the concern about the coronavirus.
Yeah, I was going to say, and that I'm sure is news to some people. I mean, if you're in a room and someone's coughing and sneezing, not good, but is that actually, compared to how many times most people touch their faces, is that less of a vector for transmission than touching your own face?
Well, it all depends on where the source of the virus in question is. So if you're in a room full of people, the advice is to do your best to maintain at least a 3-foot distance between you and everybody else, particularly someone who may be actively coughing or sneezing. Hopefully they're following the advice we're all hearing these days, which is to cover your cough or sneeze, ideally with your elbow, not with your hand. And certainly we want to use tissues and blow our noses and wipe our mouths, but ideally cover your cough in the elbow, because then it's not on your hands where you would spread it to other people. What I've been saying lately is fist bumps and elbow bumps are cool. And this is a good time for us to maybe understand and be a little less cordial and shake hands a little less and do a little more fist bumping and elbow bumping.
Have you trained yourself to not keep touching your own face?
Well, I'm certainly trying, but just like everybody else, it's a habit. But every time I do it, I say, I should do that less. But it is very difficult to retrain ourselves. Easier to avoid close contacts, stay home when you're sick, keep your kids out of school when they're sick, and wash your hands frequently.
Shall we revisit masks? Because we even had the Surgeon General tweeting out over the weekend, stop buying masks. They're for people who are sick so they don't get other people sick, not necessarily for you walking around trying not to get sick.
Yes, stop buying masks. The greatest indication for masks is for healthcare workers and people at home taking care of patients with coronavirus or suspected coronavirus. But flocking to the stores and searching online to buy masks to prevent the spread of the infection is not advised by any of the public health authorities.
Are people freaking out too much?
Well, I I hesitate to comment. Everybody is responsible for their own reactions, but I would caution people to think about how they respond each and every year to the cold and flu season. Influenza remains a much greater risk to the general public. Getting a flu shot is core to that, and many people opt not to do that. Being as healthy as possible, getting plenty of sleep and exercise, managing stress, drinking plenty of fluids, and eating a healthy diet are all things we should all be doing all the time. My advice is be calm, prepare yourself and your families, make sure you've got an adequate supply of food and medicine in your home. Pay attention to what you're hearing from the CDC and local public health authorities, and do your best to stay informed and stay calm.
I mean, if anything, this is Los Angeles. We should probably have some of this stuff in our earthquake kits anyways by now.
Absolutely. The everyday precautions is what we should be doing. Yes, this is a new and unknown virus, and there are still many questions about it, but there are many other much more common threats that are very real. Influenza occurs in much greater numbers and is a much more increased risk in the United States than coronavirus at this time. And certainly in Los Angeles, as you said, the reality of fires and earthquakes is much higher.
Let me re-ask the question I asked before, but I'll modify it just slightly. How much, if at all, are you freaked out as a physician?
Well, I am not freaked out at all. I don't care for patients personally every day, and it's a great challenge for the doctors in practice every day, seeing patients and trying to determine, well, what's a normal cold and flu, and where might I be more concerned about coronavirus. But the number of cases are still very limited, and the public health department is advising physicians on how to get testing done. The number of places where tests can be done are increasing, but I am not freaked out, but preparedness is the message we want to get across to the general public. Preparedness, not panic, and do the everyday things that we know we can do and that do work, rather than worry about what we can't do yet.
Dr. Richard Seidman, Chief Medical Officer for LA Care Health Plan.